When it comes to having a baby here in the U.S., like a lot of things, it is not cheap. And by the way, that cost could be going up for millions of Americans because of Medicaid changes in President Trump's Big Beautiful Bill Act. We'll back up here for a second. The average cost to have a baby in America is nearly $19,000 without insurance. If you need a C-section, that number goes up to around $26,000. And that's not to mention the price of emergency care. So how important is Medicaid here? Well, Medicaid helps pay for 41% of births in America, according to KFF. And in rural communities, it covers nearly half. But the new budget law sharply cuts Medicaid's federal funding and largely leaves it up to the states to decide if and how to supplement care. So what does all of this mean for the families going forward? We are joined by the Senior Vice President of Public Policy and Government Affairs for March of Dimes, Stacey Brayboy, to get an idea. Stacey, good morning. Thanks for being with us.
Good morning, Dana. Good morning, Vladimir. Thank you for the opportunity to join you.
Let me start with just sort of this basic level. If it's up to the states to eventually supplement, we don't necessarily know what that is, but what kind of impact are you expecting to see these cuts make when it comes to maternal care?
Dana, let me just share with you that what we know is with the passage of H.R. 1 and the president signing the Big Beautiful Bill and the statistics that you've shared with the viewers, we're expecting that it's going to accelerate cuts and closing of hospitals across the country. We know that 80% of maternal deaths are preventable deaths here across the country. And more importantly, when we look at rural America, and we look at the impacts that are there, it is going to lead to states having to make drastic cuts when it comes to their budgets. Well, we know that there's 10 states that are currently set up, legislated, so that they will be called trigger laws that go into effect. And Virginia, the state that our headquarters is in, and one of my home states, is one of those trigger law states. And what that means is immediately when that federal funding has disappeared, they have to come up with cost-saving measures. And if there are no measures, it is to protect the budgets that are within their states. So they're going to be tough conversations that are going to happen at the state level, as well as looking at hospital closures that could potentially happen in rural areas and maternity care deserts across the country. So it's a significant impact. And what we know for sure, Dana, is that this is not political. This is personal, and that we have lives that are hanging in the balance.
Yeah, and Stacey, very bottom line here, does this mean it's going to be more dangerous for a lot of women to have children now?
Dana, absolutely. The data shows us this. Just recently, this week, we received studies that show that 78% of the infants that are born here in our country, here in the U.S., one of the most advanced nations, are more likely to die than they are in any other wealthy, developed nations in the world. And so I think that that is a statistic that we've definitely got to lean into and look at, and because that increases the percentage of premature births here in our country.
So how is the March of Dimes shifting its response, and how soon could we see this? I mean, if you are, for example, pregnant right now and these cuts go into effect, are we talking about an immediate effect, or will there be some lag time?
Vladimir, let me answer that. It's immediate. It goes in immediately once the president had signed, once this law was signed by the president just a few weeks ago. It impacts the mothers who are pregnant now. It impacts the mothers who are giving birth. It actually impacts mothers that are in the hospital, and more importantly, those infants, those tiny little babies that are in the NICU. They no longer have coverage. So this happens immediately, and the impact is a drastic impact across this country. And I just think that it's a gamble that we're not going to be able to take, and we've got to look at, when we talk about cost-saving measures, I think it's a gamble that ends us in the long run spending way much more, and it's going to impact each and every one of us. Even if you're not a mom that is currently expecting, but your family, if you're a family, aunt, a cousin, this is something that we all can relate to. So yes, it happens immediately.
All right, Stacey Brayboy, thank you for the time, and thank you for a little bit of insight into something that is not going away for anyone out there. Thank you.